Well, with days like today and days that we dream of going to the beach, we're all eager to be outside, but we need to protect our skin. Skin cancer is the most common cancer in the U.S., yet many people don't realize that they are at risk or take necessary steps to protect themselves. So Dr. Karina Paci with Cone Health Dermatology is joining us to review kind of the do's and the don'ts of skin cancer prevention and then how to spot warning signs early. All right, so let's first and foremost talk about just the danger of skin cancer, especially when it is not caught early.
Yes, well, thank you so much for having me. I'm joining you from Cone Health Dermatology. Dangers of skin cancer. So, skin cancer in general, some of the more common types of skin cancer are actually the most common type of cancer in humans. There are different types of skin cancers, and the severity of them is going to depend on the type. So, in general, we have two categories: the non-melanoma skin cancers, those are going to be your basal cell carcinomas and your squamous cell carcinomas, and then your melanomas, they're in their own category. Melanomas, they kind of behave a little differently. Those are going to be kind of dark brown or black lesions. Those do have a risk of spreading to other parts of the body, so we want to catch them early. Squamous cell carcinomas, those are the second most common type of skin cancer, also non-melanoma skin cancers. Those also have a risk of spreading. It's a little bit less than a melanoma, but it's still something that needs to be given attention and treated timely. And then the basal cell carcinomas, those are the most common types. Very rare for them to spread to other parts of the body, but those can become locally destructive. They can invade the local muscle, the local soft tissue, the tendons, even bone. So we want to get those treated timely, regardless of which type you have.
Okay, and so when people think about skin cancer prevention, does it affect everyone equally?
That's a great question. So we all have different skin types. That being said, skin cancer does affect all skin types. Now, skin cancer, as mentioned previously, comes in different types. In Caucasian individuals, in the Hispanic Latino communities, basal cells are going to be the most common type of skin cancer. In darker skinned individuals, those are going to be more common with squamous cell carcinomas. And melanomas can affect all skin types, no matter what shade of the Fitzpatrick skin spectrum we're talking about. So, to answer your question briefly, yes, it affects everyone, but there are varying levels of risk depending on what skin type you have.
Right, but everybody can get skin cancer.
That's right.
Okay, if you've got skin, you can get skin cancer. All right, so sunscreen, we know that that is a must. What should we be looking for on the label of our sunscreen?
That's a great question. So, in general, we recommend SPF 30 or more. No matter what you're doing, if it's on your face, if it's you're going out for the whole day at the beach, we want you to wear SPF 30 or more. Now, the SPF, the sun protective factor, being 30 or more means that it's protecting against 97% of UV rays. So anything above 30 is just an incremental increase in protection. That SPF 30 is the most important factor. Now, beyond that, there's two types of sunscreens. There's the mineral or physical blockers, and then there's the chemical sunscreen. So just to differentiate the two briefly, mineral or physical blockers, those are the ones you think about when you think about the olden days, the lifeguards with the white stripe on the nose. Those are made with a physical blocker, usually comes in one of two forms, either zinc oxide or titanium dioxide. So if you were to look at the back of your sunscreen, you would see those ingredients on there. Those are a little less elegant, but they actually physically reflect the light off your skin. Now, chemical sunscreens, those are the most common ones that we find in moisturizers. They're a little bit more elegant. Those are going to absorb the UV light instead of blocking and reflecting it. Those can be made into very elegant products. They're not white and chalky, but those are going to have products on the back that are going to sound like a lot of them have benzone in it. So like oxybenzone, avobenzone, those have a slightly higher risk than the mineral sunscreens of causing a contact dermatitis where you could get some irritation on your skin if one of the products you're using just doesn't fit with you quite right. But in general, both types of sunscreens are going to provide adequate sun protection as long as we're going with the SPF 30 protection factor.
Okay, so 30 is the most important. How about putting it on?
Yes, yes. So on the face, we recommend no matter your skin type daily with a moisturizer SPF 30 or more. So that's your daily application. And then if you're going to be outside for the day or a half day, going to the pool, going to the beach, At that point, SPF 30 or more, but really you need to be reapplying every 2 hours. So even if you have SPF 100, you need to be reapplying every 2 hours because at that point you're sweating, there's a lot, it's doing a lot of work and it's getting used up. And so you want to be reapplying, making sure you're staying protected the whole time that you're outside.
All right, now some people may say, well, I have a good base tan or I have darker skin, I don't need sunscreen. And you say what to that?
I say false. Those are false myths. Those are a base tan does not protect you against further damage. It's just the initial response from your body trying to protect itself from an intense amount of UV exposure, but you're still getting that UV damage even after your base tan. And if you have darker skin, while yes, in general, darker skin has a little bit more protection, they still can create skin cancer, and the UV damage is happening regardless of your skin color or skin type.
Let's talk about clothing. Lots of fabrics, clothes, that kinds of things, hats, sunglasses. They kind of say that they will offer some sun protection. What are the best kinds of things for us to wear?
So in general, just your standard piece of clothing that is not specified as being a sun protective clothing, just like any shirt, is going to have a UPF of 4 to 5, which is basically like an SPF. So that's really nothing. So what you're looking for is clothing that has a UPF. So instead of SPF for clothing, it's called UPF. And you're looking for anywhere from 30 to 50. So that's literally in the fabric. They make shirts, they make hats. So wide brim hats are much better than baseball hats. They get all around and protect you from getting exposure all around your ears, your neck. And they actually made wide brim hats with UPF in them. So that's actually even better than just the wide brim hat itself. So basically you're going to be looking for UPF 30 to 50 in your clothing or in your hats, wide brim hats, and then sunglasses also.
All right, and what are the most overlooked areas people forget to cover with sunscreen or with clothing that skin cancer can develop?
Yeah. So in men, a lot of times I get a lot of patients who like wearing baseball caps. And so the back of the neck, the ears, the neck, the chest, they tend to be overlooked and get a lot of sun damage there, a lot of skin cancers. Now in women, in general, there's usually either longer hair or styles that cover the ears, but one of the most common places for skin cancer on women is actually the lower legs. And then the chest, because we wear low cut shirts, the hands when we're driving. And you can actually get skin cancer anywhere that you have skin. So that includes the bottom of the feet, the palms, even the genital areas. Those can also get skin cancers. They're not always related to sun exposure, but those are all areas that you can develop a spot that you need to have looked at if you're concerned about it.
Okay, skin cancer can travel. Doesn't mean that it's just whatever your sun hits. All right, so in addition to taking steps to prevent skin cancer, we need to be checking our skin for warning signs. What should we be looking for?
That's a great question. So, in general, skin cancer is not going to go away. So, it's not even going to come and go. It's just going to come and stay. So, you're looking for a non healing lesion. Depending on the type of skin cancer, it can present as a pimple like lesion, a scaly spot, something that's bleeding, something that's tender, something that's growing and not going away. They can be pink, they can be red, they can be skin colored. And when you're thinking about melanomas, those are the more traditional, like when you think of the ABCDs of melanoma, those are the A for the asymmetric borders, B for irregular borders, C for color difference, so it's not evenly colored throughout, and D for increasing diameter, so something that's growing. Melanoma can present as those dark brown to black lesions, but it also can present as a pink, almost subtle skin colored lesion. So there's a lot of things to look out for, but the general consensus is if it's not healing and it's new and it's not going away, you should probably have it looked at.
Yeah, I think too often we look at something and we just kind of pass it off and we're like, oh, it'll go away in a little bit.
Yeah, yeah.
All right, got to get that checked. All right, so skin cancer warning signs different for people with darker skin tones than those with lighter skin tones. What should we be watching out for?
Honestly, in general, those warning signs are going to be the same. So they may not be pink or red in the darker skin types, but they're going to not look quite like the rest of the skin. They're going to be darker, or they're going to be really scaly or have like a thick crust on them, or they're going to be bleeding. Sometimes they don't hurt. Sometimes they're not tender and they're just growing, but sometimes they are. So pain doesn't really indicate one way or another. But if it's new and it's not going away and it's growing and it's causing you some sort of concern, you should come in and have it checked out by your board certified dermatologist.
Okay, that was my next question. When we find a new spot, is that what we do? We just go straight to the dermatologist versus going to our regular doctor?
So in a perfect world, the answer would be yes, but unfortunately there's a large shortage of dermatologists nationwide. So the best thing to do is, if you have an established primary care doctor or primary care provider, is to contact their office. Usually they can get you in really quickly, like same day or same week. And then if it's a spot of concern, they can send a referral to the local dermatologist. Now within Cone Health, we have a great referral base. In general, we are requiring our patients to have a referral from their primary doctor or some doctor. And then that way you can get in quickly. Now, access to dermatology has been really hard nationally. The wait times are really long. I will say we recommend, if it's a spot of concern and it doesn't require a full skin check at that time, it's much quicker and easier to work patients in for like a 10-minute appointment just to look at that one spot. And then once you're established, it's a lot easier to get them in for like a full body skin check. But just letting them know a new spot that's not changing and I just want that one spot checked, that's usually a good foot in the door.
Gotcha. And you should definitely go see your dermatologist once a year. That's just like one of the routine things that just need to be done. We
Yes.
thank you for your time and your expertise. If you missed any of this, this is going to be in the To Your Well-Being section of our website.